And hello. So, hi everyone. Welcome to our new podcast series, OT Spotlight. And each episode will have different professionals to learn more about their unique experiences in their field of work, and hopefully they can bring their insights to our listeners. In this episode, we're being joined by Dr. Jodie Sandel. She is an occupational therapist who has worked in a variety of settings, from hospitals to outpatient clinics. She will share with us her thoughts on what it takes to be a successful OT, and also offer some advice for those considering a career in occupational therapy. So aside from offering us some insights into the field of occupational therapy, we're also going to be talking a little bit about critical issues facing occupational therapy and the aging population. So it might not be necessarily in that order, but we will do our best to make sure that it happens in this short time frame. It is my first podcast, and it's going to be short, but hopefully very informative. So without further ado, here is Dr. Jodie Sandel.
Hi, good morning.
Good morning, doctor. So how are you doing today?
I'm great. Really excited to be part of this podcast with you.
Oh, thank you very much. So just, there's things that people always want to know. Obviously, I know because I went through your program. And I'm a certified occupational therapist assistant. Okay, don't try to get too far ahead here. Okay, I'm on the process. Okay, so now some of our listeners, might not be occupational therapy practitioners. Can you let us know what exactly occupational therapy is?
Sure. So I agree with you. There's a lot of people that don't understand what occupational therapy is. Occupational therapy is a profession that helps individuals from 0 to 100, if you would, to help them gain independence in their everyday life skills. Also, some of those activities that we do that require like higher order thinking, such as managing our checking accounts or making decisions if we are not able to make those decisions anymore because of some type of an injury, such as a brain injury or a stroke. It also helps in areas of mental health, pediatrics. It's a very broad scope of population that we get to work with. But the key takeaway is to help this individual become as independent as possible.
Great. So letting us know that it basically covers such a broad, how can I say this?
Like a broad scope.
Like a broad scope. What do you think are the most important qualities that someone needs to become an occupational therapist? Because it does cover such a broad scope. Do you think there are certain qualities that somebody needs to become an occupational therapist?
Absolutely. I think we need basic human need qualities, and we need qualities such as empathy and willingness to help others and wanting to ensure that we can advocate for our patients and be the voice for our patients who do not have a voice. So it takes somebody with a lot of compassion. It takes somebody who can think outside the box, because occupational therapy is not a scripted profession. We have to think outside of the box to help our clients achieve the independent levels that they're wishing to achieve, or to get them to do the things that they are unable to do. So we get a really pretty cool, I should say we have a really unique way and a unique approach to it. So the individual has to be creative in addition to those human needs.
Great. So is this one of the reasons? I'm sure there's many more, but is this one of the reasons that inspire you to become a professor or an occupational therapist practitioner?
Absolutely. So before I went to school to become an occupational therapy assistant like you did, I worked in the medical field. I worked in insurance. I worked at doctors' offices, and I knew I wanted to be in the medical field in some fashion. And I researched different professions. I looked into probably the most popular one that people look into, which is nursing, and realized that really wasn't for me. And I had a visitor, a friend of mine who is an occupational therapy assistant in Austin. And she told me a little bit more about the profession. So I looked into it and I said, I think this is me. I do this way of thinking already. I want to help people, and I want to help them find solutions so they can be independent in their lives. And so that kind of just got the ball rolling, or it got my mind into thinking of becoming an occupational therapy assistant or an occupational therapist. I didn't know which way to go. So I started with OTA.
And how did you make that transition from being an occupational therapy assistant to, you know what, I'm going to continue and I want to teach now. I want to give back.
So,
I want to be a professor.
Absolutely. So, I felt that I was a very successful occupational therapy assistant during the years that I worked in inpatient rehab and inpatient mental health. And I really enjoyed teaching my clients how to do whatever it is that our goals and the focus was. So when I realized that, I thought, hey, how can I get to more people, right? And there's only one of me, but if I turn to the profession of teaching, I can teach other people who can help other people and pay it forward. So if I have 8 patients in one day, I can teach 10 students who eventually will have 8 patients in one day. And now there's 80 people that are being helped or through the profession. So for me, it kind of came hand in hand. Occupational therapy, the profession itself, is a lot of teaching when you're working with your clients. And so it
Correct.
just felt pretty natural to go in that direction. And I had a lot of people just push me and not saying in a bad way to push me to become an educator, but saying like, you've got what it takes to become an educator. Go in that direction, but keep your core profession and your core values.
I really love that, how you're saying that, you as one person can only teach so many, but if you teach, 8, 10 people, then those people can just expand and teach a lot more. That's such a great way of looking at it. I never really thought about it that way, but it's true. It's kind of like us, like me now. Now that I'm working in this profession, I go home and I might teach somebody something in my home health setting, but I don't just teach the patient. Now my job is also to teach the family members, so that way we can just do better for everybody in general. So that is a great way of putting it. So now I do need to ask you a couple of questions regarding some critical issues that are affecting occupational therapy. And one of those issues is how it's affecting our elderly population, at access to care, and so forth. So do you have any insight that might help us understand what's happening with those issues currently in our profession?
I think I have some theories that can help. I think, first of all, we live in a community that is unaware of the contribution that occupational therapy has to our population and our community. And so with that, there comes the challenges of having physicians refer elderly patients to occupational therapy. And unfortunately, in the demographic that we live in now, right, where we live in Laredo, the occupational therapy services that a patient's receiving could be in a nursing home. As you mentioned, home health, because I do home health as well. And I'm not seeing the people, like additional people that really need therapy services. Like I'm not seeing them receive those services. And so the challenge is educating the professionals that are referring these individuals. The challenge is advocating for this patient and the family members, and to teach the family members how to advocate to push for services. I actually received a call from my uncle yesterday, and he's an elderly man. He's having some issues. We talked about what he needed to do. And if he hadn't reached out to me and I could teach him a little bit about how the system works, about the referrals and talking to your doctor and pushing for a referral for a specialist and for therapy services to address his balance issues, he would never have known. So we have a lot of challenges that we face, professionals, family members, patients themselves.
Yes, that's funny that you mentioned that, because especially when you're talking about balance, right? There's a lot of lack of knowledge, like you said, when it comes to referrals. It's mind-boggling how some doctors still don't refer us to occupational therapy. You know, they see somebody have issues with lower body extremities, and then they're like, oh, you know what? We're going to send them to PT. Oh, they have balance issues. We're going to send them to physical therapy. And so, and I've been seeing that a lot and reading also online, where a lot of those professions are also jumping and focusing on aspects that are done in occupational therapy, you know, like activities of daily living. We just see that. I've been seeing that day in and day out. So what do you think that is happening?
I think it's almost like a snowball effect. So you have providers such as, we're talking about like insurance providers, you have Medicare and Medicaid, who sets the standards of what is covered and what is not covered for an insurance in their eyes and their philosophy. I don't know really what word I'm looking for. But so you have these people that set the rules of, you know, what kind of services should be covered and by who, but yet they don't have the actual professionals in there saying, hey, wait, occupational therapy does need to be in there because these issues are related to a person's daily living tasks. And so what they are saying is that when we do refer these services, all of these professions, they need to have functional outcomes and functional goals. So what's happening is there's different professions such as physical therapy who now has to include a functional attachment to their goal. Therefore, it appears as if they're overstepping into other professions. And I think that there's a miscommunication in exactly what these different professions focus on. Now, you could have a patient that needs occupational therapy services and physical therapy services, and they may be so related, but they are so different at the same time, and what the overarching goal is. Physical therapists may be able to get this person to balance while they're walking, but what about balancing while they're cooking and balancing while they're taking a bath or balancing while they're getting dressed? And so you have a lot of overlap, I think, between professions, and people have not been able to delineate that line. So, oh gosh, Edgar, this I don't want to misinform people either. These are just things that I've been seeing in my years of being an occupational therapist and dealing with insurance companies and dealing with different professions. And so I think it goes back to reimbursement. They set the rules, they tell you what's covered, and we as professionals, or the professions, ancillary professions, have to figure out a way to get that covered so that our patient can get the services that they need.
So insurance coverage is a big impact on access, huge impact to access to occupational therapists and the way we provide services to our patients. So how, as an occupational therapist practitioner, what can we do to try to push so we can get those services provided to our patients? How can we advocate for our patients and for the profession in general?
I think this is a really good question. And it's something that I know I, as an educator, did try to push during teaching, right? Our students, is that becoming members of your American Occupational Therapy Association and contributing to AOTA PAC, which is their political action committee. These are people, these are lobbyists that are going to go fight for our patients, but they can't go fight for anybody if we're not supporting them and being advocates within our own profession. You know, speech therapy is required to be a member of their association, of their national association. I almost feel like occupational therapy and physical therapy both should also be required to be members in the association. But right now, unfortunately, it is voluntary. I have maintained my membership in AOTA and AOT PAC because I truly believe that OT needs to be at the front and forefront and foremost when we're discussing therapy issues for our clients. We need to be able to have the best reimbursement rates, right? And the most different types of diagnosis or treatment modalities or whatever it is that we need to treat to be able to help these clients. So, aging in place is something that we've covered in occupational therapy. And I don't know if you remember that while you're going through the program, but that's a huge thing right now because you have a lot of baby boomers. There's a huge elderly population right now. And so who else to advocate for these individuals? Like, we need to do that. But if we're not members of our own association, then we're doing no justice to our patients.
Yeah, correct. It's actually, they've made it easier. ALT has made it easier to become a member.
Absolutely.
I remember when I was a student, the fees, they weren't bad. And I remember when I graduated, I was like, oh my God, how am I going to pay for this? But now they've made it where they're charging you a monthly fee as opposed to paying a yearly fee.
Right.
So that just made it way, way better. So you'll be proud of me.
Good.
I'm still a member.
Oh, good.
I'm still a member.
And stay a member.
And I get my little, and I'm getting my magazines every month. And there's a lot of valuable information out there that, that we need to still read.
Absolutely.
Okay.
Yeah, we need to be advocates, and that's one of the best ways to advocate for our patients.
Another question that I have for you, Dr. Sandel, what advocacy groups do you see that are working on behalf of seniors and the right to access occupational therapy services besides AOTA?
Besides AOTA, that's a hard one because I did some of that research on my own as well, and I came across a Texas Health and Human Services group that's the Aging and Disabilities Resource Center. You can find them online, and that helps people get access to different type of care. There's also the National Council on Aging, which is the ncoa.org, that in addition provides resources to help individuals access care or access the needs that they're needing. Don't include that one. The access the needs that they're needing. You're going to have to clip that one out. And to access the services that they need.
All right, doctor. So I think we got enough here. I'd like to thank you for sitting in here this morning and giving us your insights on what it is that we need to do as professionals, and not just as professionals, even to our listeners, what we need to do to advocate, not just for our profession, but just for the elderly population and for people that are going through mental health, and for our children who need therapy services. We as a community, we need to do more.
Absolutely.
Right? And that's why it's important to get to the ballot box so we can vote for people that are pushing for services that our community need.
Well, and contributing to your political action committees, AOTA PAC, even if it's $5 a month or $10 a month, you're contributing to the lobbyists that are going to Capitol Hill to fight for the services that our community needs or that our patients need.
Correct. Well, Dr. Sandel, thank you very much. Thank you for stepping in this morning. This was very informative, and hopefully we can do this again sometime in the future. I know this is my first podcast, and it might not be approved by the college to be put out into the open, because you know how that is. But, if I'm going to try after this class is over to hopefully keep it going, but for my own personal reasons, because I am on my road to be an occupational therapist,
Good.
And I thank you for that, for putting that in me. And this, I know this is going to keep me fresh while I'm in my process while I'm in my journey to be an occupational therapist. Mm-hmm. So thank you very much for everything that you've done, everything that you're doing to the profession, and everything that you helped me with.
It's an honor.
These last couple of years.
It's an honor to be part of your educational journey.
Thank you. Bye-bye.
Bye.